Hi, Professor. This is Nidia Pozo, the class for Bio 240. Professor, this video is about the dissection of the sheep heart structure, external and internal. So the first thing is, this is the sheep heart. This is the anterior view of the sheep heart. Some of the major structures that we can see are right auricle or right appendage, which is the right atrium underneath, the left auricle or left appendage, pulmonary artery, which is the more predominant at the front. Then you have the aorta, the bronchocephalic artery, and the branches out of the aorta. Also in the anterior surface, we have the half diagonal interventricular septum dividing the right ventricle and the left ventricle. The basic left ventricle is the apex of the heart, the point of the maximum intensity, and is near to the left nipple. The posterior view of the heart, you can see a horizontal light or coronary sinus, and you see a lot of the blood vessel that can be cut off because the atriums, which I will show you later. Now, back to the anterior structure. We have, so we're gonna go with the right ventricle. Left ventricle, left atrium, which is inside of the left appendage or auricle, like an ear flap, the right atrium with this right auricle or ear flap, and then the other major landmarks in the anterior surface view is the pulmonary artery, which is the most anterior blood vessel that can be seen. So now, another major structure found in the surface of the heart are the coronary arteries that feed the heart muscle or myocardium. This is the ones that get blocked by fat and can cause a heart attack. There is one major coronary artery, and they branch out of the base of the aorta, which cannot be seen, but we'll show later when I got here to the aorta, which is the big one here. You can see it here, all the lines right here, which are the ones that can get clogged. Now, there is a different view of the major structures, which will be, like if you see it in the side, you're still looking at the right side, left ventricle. So now, if I will cut it in the frontal plane, it will show the internal structures. Now, every heart will look different depending on the cut and how did you cut. Internal structures between the right ventricle and the left ventricle. The landmarks is thick myocardium that surrounds the left ventricle. You can see left ventricle connects here with this left. So it's a half connected because I cut it. The right ventricle, it has more thinner myocardium, and you can see it right here. Chambers surrounded by the right ventricle myocardium, which is thinner. And so you can see it right here, right? And it's totally thinner. So now, take a look at this half. Let's look at the right ventricle and the left ventricle. Above the ventricle is the atrium, is the receiving chamber thin wall between the atrium and the ventricle is always intravertical valves. The right side is the AV node or tricuspid. And then this valve, it can be easily found, like you can see like a little cord or thicket coordinate is the one that protects the valve from flapping it and going the blood to the wrong place. So holds in place the valve. Now let's go and try to see the circulatory right atrium. Blood flows by the vena cava, we then pass the atrium vertical tricuspid. So you can see, and then flows down to the right ventricle. From the right ventricle, which you can see in the side of the heart, will go up to the pulmonary artery, which is one of the most anterior blood vessels, as I show you in the circle of the heart. Lungs will get full to get oxygenated and will return to the left atrium by the pulmonary veins. So the back side of the heart, you'll find the pulmonary veins. You can see the left atrium, which is the thicker. So left is thicker, right is thinner. And then enters the left atrium, past the bicuspid valve. Notice the heart attached to the bicuspid. And then the blood goes to the left ventricle and moves to the back side of the heart. And it's gonna pump out of the, moving past the semilinear valve. It looks like a thin half moon or thick valves that allow blood to move up and out. And it will go back to the ventricle again. And they passing the semilinear and the valve shut to put the blood out. Now you can see the aorta. The aorta is the big one and the thick one. And then you see the branchocephalian artery, which is going to carry the blood to the head. See, and the rest of the body. And we'll return back to the right atrium, to the vena cava, right to the tricuspid, enter to the right ventricle, to the pulmonary artery. And the cycle goes again, upper and upper. So as you see, we have here the aortic semilunar. We have the aorta, which is the thicker and bigger of our veins, and you can see that is one of our biggest hole right here. So you're gonna put the aorta, the pulmonary veins, which are in the back of the heart, and then I want to be sure that you take a look at the coordinate tendons, and as well the papillary muscle, the papillary muscles, which are right here, so you can appreciate it right there. And you can see that. And then the superior vena cava and the inferior vena cava, which are more appreciative when you do it this way, and you go superior and inferior. So you can see that part. And then of course this one is still the septum that divides, so intraverticular septum is what divides the heart, and it tells you what is the ventricles, and it tells you what everything is. Of course, remember we have the epicardium, myocardium, which is the middle, and the endocardium, which is the most inner in the heart. And that's the video for me. Thank you for watching. Until the next one.